chills. And Bansha Sheshintang does not treat those heat signs, but treat gastrointestinal symptoms. That's Bansha Sheshintang. And drain downward formula. So all summarized here. Dahwang treat which one? Shi, mess. And Mangshao treat Zao, dry, small stools. And Hopo treat Man. And Jishi treat Pi. Pi, Man, Jishi. So board will not, maybe not give you just directly those literal words like Pi or Man or Chi. But you should know the meaning. Then you can combine the right formula by connecting those two dots, Pi, Man, Zhao, Shi, and each herbs. So if the question asks you, there is no dryness of the stool, right answer is Xiao Cheng Chi Tang. If the patient has all this Pi, Man, Zhao, Shi, there's Da Cheng Chi Tang. Only the patient has stool problems, Shi and Zhao, without any gastrointestinal problem, there's Tiao Wei Cheng Chi Tang. So it's a simple connection with Pi, Man, Zhao, Shi. Remember this. And Run Zhang Wan. And this is the only formula without Dawang. This is the only formula without Dawang. There was a question about that. Not directly ask you which one has not Dawang, but can be asked in many different ways. All other formulas has Dawang. So this is only for elderlies and deficiency condition. But something really confusing is Machirenwan. Let's go back to Machirenwan. Machirenwan has Dawang. So it is commonly used for elderlies, but remember, this one treat heat signs. So Machirenwan, people usually think this is for deficiency, but it treat heat signs. And Taoren Cheng Chi Tang is another combination with Cheng Chi Tang, Da Huang and Mang Shao, but with Taoren and Guji, just like Guji Fuling one. So this is kind of Guji Fuling one for excess condition with low abdominal pain, menstrual pain with the distension. So purplish lips, those Guji Fuling one signs, but with a constipation. If there's a constipation, you should pick Taoren or Taohe Cheng Chi Tang. Next, phlegm formulas. Bansha Baichu Tiamatang. Bansha Baichu Tiamatang treat the dizziness by phlegm. And phlegm and expelling wind with Tiama. So phlegm and wind. There's Bansha Baichu Tiamatang. Bansha phlegm and Tiama wind. And Baichu tonify spleen not to generate the phlegm. So Baichu treat the root problems. It is based on urchin tongue. So what is the keyword? Dizziness and spleen deficiency symptoms and wind symptoms. And there's something weird about this purse. So you need to memorize this one too. Wiry. Slippery, of course you can get it because it is the phlegm. But considering Tiama, question board examination can give you wiry purse as a right purse too. So it is kind of not that intuitive. Memorize it. Bansha Baichu Tiamatang treat wiry purse too. And Wendan tongue, it is also another variation from urchin tongue, but it treats heat and excess heat. And Bansha Baichu Tiamatang for spleen deficiency and wind. But this one, wind, heat, phlegm. So herbal treatment for goiter, this is something you need to remember because it was once in examination. Wendan tongue. And which herb need to be added? Severe phlegm heat with the kind of extremely heat signs. Then Huangnyan is the right answer. Huangnyan. And it is called Huangnyan Wendan tongue. So commonly combined with Wendan tongue is Huangnyan. And Bao Hewan is another variation from urchin tongue with phostasis, Shenku Maya. So what is the keyword for this formula? Foul smelling, rotten eggs. So this is not, these kind of symptoms will not be given for the hint for Pingwei-san. So Pingwei-san and Bao He-huan is very different. And Pingwei-san is for dampness and Bao He-huan is for phlegm, so slippery purse. So when the people has a severe distension, what is the proper modification? Common question, Jishi and Hopo for Bao He-huan. And another variation from orchantang, qingqi. Qing is clearing, so it clears heat. And also remove the phlegm. Yes, wendantang remove the phlegm, but that is for heart and gallbladder, for mental disease. But qingqi huadanhuan, qi means lung, and qi, air, pneuma. So it treats respiratory symptoms with the heat signs. So there is another variation from orchantang, and it treats thick yellow sputum. So patients should have a wet coughing for qingqi huadanhuan, not the dry coughing for wet coughing, and slippery, rapid heat signs, while beimugolusan is for sticky phlegm, not completely dry phlegm, but sticky phlegm. For completely dry phlegm, you'd better use duchi1 or my way D11 for tonifying in. But beimugolusan is for phlegm, but sticky, not hard to expectorate. So it is for subacute condition. Which herb can be substituted bansha in case of phlegm is dryness? That explains the composition of beimugolusan, beimu. So in this formula, bansha from orchantang is substituted with beimu. And jisosan. And this jisosan literally means stop coughing formula. And this is kind of keyword. It has jingje, so it releases exterior. Not like other formulas for coughing. It releases exterior with jingje. So coughing with exterior symptoms. Okay, and G1, Baijan, Baimugen, and Jigen all treats just coughing. There's not much of rules. And Jingje is the only one release exterior, so it is more focused on coughing, Jisosan. It is very common used formula actually. It can be used for variety of symptoms, not that cold, not that hot. That is Jisosan. And Hoshang Chengchisan is a combination of orchantang and pingweisan, and also dampness and phlegm and exterior. There is Hoshang Chengchisan. What are the keywords? Vomiting and dryness, diarrhea simultaneously. We call this in Gwangnan. In ancient times, Gwangnan is vomiting and diarrhea simultaneously with exterior cold signs. So it is like an enteritis, stomach cold. That is Hoshang Chengchisan. Ulingsan for diuretics and also exterior symptoms. Remember this. This is for exterior symptoms, and there are three keywords for this formula: exterior and thirst and vomiting right after drinking water. Patient tried to get out after acupuncture and took a cup of water, and he instantly vomited that water. Then what is the right formula? That's Ulingsan. So exterior symptoms and thirst and vomit and urinary distension. Those are three keywords. And Ulingsan also has a heat signs, so cold-like symptoms. And this formula belongs to Taiyang symptom. And Taiyang symptom include fever, so it treats feverish symptoms too. And Jeishe is the king herb. Remember this one too, because it is not that intuitive. It is easier to answer with fooling. But Jeishe is the king herb, and it treats urinary symptoms with exterior symptoms, so it treats fever. Remember this one is a Taiyang medicine. So Taiyang includes fever. And dry after vomiting, that is the keyword you need to remember. And Julingsan is for excess heat, the internal heat, by nourishing in with urchao. And it treats fever, obviously treats fever just like Ulingsan, but more interior heat. And Ulingsan treats exterior heat. So Julingsan treats fever, thirst with strong desire to drink. There's no vomiting. This is the difference between Ulingsan and Julingsan. Ulingsan release exterior with guichi, and Julingsan clear heat with huashi and tonify in with archao. Ulingsan and Julingsan. And Upisan is for general edema. That is the keyword you need to remember. General edema. And skin edema and general edema. Yeah, generalized edema. In Chinese word, we call that pisu. Pi is skin. So skin edema, generalized edema by spleen deficiency. Spleen deficiency. This is the keyword for 우피산. 우피 means 5 pills because it used the pills like shenjangpi and it treat generalized whole body in a superficial area. That is 우피산. So connect this P and P. So generalized edema on the superficial area with spleen deficiency. Weak spleen cannot regulate water. That is the pathology behind it, 우피산. And 빠쟁산, you should remember antibiotics. So if the board examination asks you in many different ways, likewise, patient has a acute prostatitis or the urinary infection or taking amoxicillin. So can ask you in many different ways, but what does that mean? Patient has inflammation and infection, then it's 빠쟁산. Not 100%, but 90%. And there are many questions, has been in board examination about 빠쟁산 with those hint, with antibiotics and inflammations and those what the biomedicine and diagnostic name. That is 빠쟁산. That is the keyword. Something like this, acute prostate problems. Or gram-positive. So urine culture showed gram-positive germs. So there are many different descriptions. So 빠쟁산, never miss this question. 젠우탕. 젠우탕 is for yang deficiency. Severe yang deficiency. I told you 젠우 is a mythological creature. 젠우. Not true warrior. This is a mythological creature taking care of north side. So very cold condition. It treats extreme cold yang deficiency. This is 젠우탕. Extreme yang deficiency with fuji. Remember that. Which formula treat in type of edema? With tonifying yang herb, that is 젠우탕. In type of edema with the yang tonifier because it is very extreme in. 젠우 literally means extreme in, north, water, pitch black water, deep water. That is 젠우탕. And 주안비탕 treat joint pain and releasing damp heat. But qianghu is added, not duhu. So it is commonly used for upper extremity. So qianghu, fangfeng is the king herb. So commonly used for neck and shoulder pain with damp, wind and damp. There's 주안비탕. But also you need to remember it has huangqi. So it tonifies qi too. 두호지생탕. So 싱수산 is also based on urchin tongue, but this is for dryness. And usually examination give you the ticklish throat. So not literally just ticklish, but they can describe in many different ways, right? Ticklish. So it is not that severe inflammation, but there's tickle because of dryness. There's 싱수산. So question can ask you like this way. Common cold-like symptoms after traveling to Las Vegas, some dry place. Not a heat, but dry place. And ticklish throat, and with mild symptoms, not the severe symptoms, not mild coughing and exterior symptoms. There is 싱수산. 싱, apricot seed, and 수 is perilla leaf. So mild early stage. 마이멘동탕 is commonly used formula. Treat variety of symptoms. 마이멘동 tonifies in, Rensen tonifies qi and fluid, and Bansha remove phlegm. So it can treat coughing and it can treat qi deficiency. It can treat fluid deficiency. So Ripers, rapid, and deficiency. This implies the Rensen, the weakness. So not that counterintuitive, but just think this way. 마이멘동탕 treat everything in subacute stage. There's 마이멘동탕. It is different from Liuwei Diwangwan, but and Bansha, 마이멘동, and Rensen. There's 마이멘동탕. And also you need to remember Shengmaisan. And Shengmaisan share the same Rensen and 마이멘동, but Shengmaisan with 우웨이지. And 우웨이지 can also astringent qi, so can be used for coughing too. And Shengmaisan, summertime, and tonifier and treat coughing. They share very similar symptoms. But only 마이멘동탕 treat phlegm, Shengmaisan does not treat phlegm. And regulating qi formulas. Banshaopotang, what is the keyword? Plump it. Remember that one. Plump it. And it treat phlegm. And Yuchuan. So the question with Yuchuan can be tricky because board examination, there are several questions in the question book I saw about Yuchuan. They usually ask you all those different signs. So if you find all those signs, pick the Yuchuan. So it is not that common. Qi deficiency signs, blood stagnation sign, and dampness signs all together. And which formula cannot be used for qi deficiency? This is only for heat condition. And what if the patient has a severe phlegm signs? Add urchin tongue. It can be on your examination commonly because this is another famous formula. Liu Chuan. Liu Yuan. Liu Yu. Yu means accumulation. 6 accumulation decoction with urchin tongue with inside. So as a right combination, remember adding urchin tongue for severe phlegm signs. And Suji Janji tongue. What is the keyword for Suji Janji tongue? This side treat excess phlegm on the chest. And this side treat weakness of the kidney, 로구이 and 당귀. So it treat upper excess and lower deficiency. And white, profuse phlegm with coughing, but weakness on knees and legs. That is Suji Janji tongue. Okay, never forget this. So weak pulse, where rare position because lower body, lower jaw. So kidney area, a weak pulse. But slippery, white, greasy tongue coating. This is excessive phlegm on the chest. So they will use this kind of term, excess on the chest and weakness on a lower jaw. This is typical hint. And Jupi tongue. Jupi tongue is very similar to Bansha Sheshin tongue. Can you see? Without Bansha, it has ginseng and ginger and ganjiao, dachao. But with Juru subside heat. So it is for nausea with heat in the stomach. That is Juru. So Jupi tongue is used for nausea with deficiency heat. Because it has a Ransan, it says deficiency, stomach qi. Reversed flow of stomach qi. And it does not harm fetus. So if the question asks you which formula can be used while pregnancy, this is one of them, Jupi. And there are some more, but remember these formulas. Jupi and Guichi Fuling one, Jiawei. Probably these are the 83 formulas to remember 3. Can be used for pregnancy. And formulas invigorate blood. And Gucci Fulingan, I told you it can be used for pregnancy. And Baishao as a deputy tonifies blood. Baishao is deputy. Why I put this white star? Because it was in an examination. This is not that intuitive, so just memorize it. So menstrual pain and the bleeding while pregnancy, those are the keyword. Shuefu Chuyutang, there are 5 different Chuyutang. Actually 4 different Chuyutang. Right? Shufu, treat chest blood stasis. So chest pain is the keyword. And please remember this composition too. Siwutang and Sinisan. So it regulates qi with Chaihu, Baishao. Actually Qishao, but they are commonly used interchangeably. Let's just summarize here. Jushu, chest, and Geisha, epigastrium, and Shaofu, lower abdomen, and Shantong, body, the collaterals, meridians, open collaterals. So this is for joint, and this is for menstruation, uterus, and this is for gastrointestinal system. So Geisha Chuyutang, so Shefu Chuyutang has Sinisan to treat those collapsing. So a very serious condition. And Geisha Chuyutang has Shangfu Uyao Jike to help the digestive system, to regulate qi. Geisha Chuyutang. Shaofu Chuyutang, a lot of warming herbs like Buhuang, Huishang, fennel, and Ganjiang Rogui to warm your uterus. That is Shaofu Chuyutang. And Shentong Chuyutang, a lot of expelling wind herbs like Dilong and Jinjiao. This is for pain. So Shentong Chuyutang, Shaofu Chuyutang, Geisha Chuyutang. And Shenhua Tang. And Shenhua Tang is for postpartum, after delivery, tonifies blood and regulate blood and warm uterus. The 생화탕. And wenjing탕. wenjing탕 literally explains it treats bleeding with blood stasis with warming property. Not warming, actually very heating property. 바오장, 우주유. It warms. And actually there is alias of this formula is regulating menstruation formula. So it can be used for bleeding and stasis, either of them. But it is classified as an invigorating blood formula. So just remember, this is a really warming formula, and 우주 is the king herb. And 단쉐닌, this is for chest. This is for uterus and warming. And this is for chest. 단쉐닌. Chest and stomach. So pain in the chest and epigastric area. Pain, epigastric area, and chest. And danshen commonly has considered as a herb interact with anticoagulant. If question asks you about anticoagulation with herbs, danshen is one of the first thing you should consider. Huaihuasan. Just remember it goes to large intestine. So it treats blood and feces. Blood and feces. So it can be used for hemorrhoid or bleeding. And tonified chi formula, Yupingfengsan, spontaneous sweating, profuse sweating. Remember that. And second, the low immune system. So frequently getting common cold and weak in wei qi. So Yupingfengsan is all about wei qi. Pingfeng is wind screen. And main ingredient, huangqi. And buchongichitang remembers two things, augment qi and raise qi. So organ prolapse. If the question has organ prolapse, if the question gives you many symptoms with Luei Diwan signs and there's organ prolapse or qi sinking, try to answer with modifying Luei Diwan by adding buchongichitang, that kind of combination, because of organ prolapse. And which herbs raise qi? Chaiwu, shengma, huangqi. And this is not in your list, California, but it can be on your examination as a modification question. Liujunjitang. And shending baijusan. What is the keyword? Diarrhea. And kidney deficiency. So Xiaoyao treat spleen and kidney, both of them. And there are formula which tonifies kidney and can be used for diarrhea, which is Shishenwan. Do you remember Shishenwan? But what is the keyword for Shishenwan? Shishenwan, daybreak diarrhea. But this one does not treat specifically daybreak diarrhea. This one treats spleen deficiency diarrhea for elderly people. There is Sanning, Baichusan. Sanning Baichu means Shijunjita. Can you tell? Shen, Rensen, Fuling, and Baichu. This is Shijunjita. So this is based on Shijunjita. So commonly used for elderly people's diarrhea. And Shengmaisan. And this one is for summer. Very similar to Maimendongtang. It also treats coughing too. Dry coughing, but weakness with Rensen. But Beimugolusan does not have Rensen, so does not treat deficiency. And Sinitang only tonifies yang, especially kidney with Fuji. Ganchang, Fuji, Ganchao. So it treats severe emergency condition with yang deficiency like collapsing. So deep, weak pulse. Very interior condition. Sinitang. Sinisan is excess condition. Jiaweitang. Jiaweitang stop bleeding, and it can be also for pregnancy. Based on Siwutang. And Aye worms. And it treats bang low, but mostly low. Mostly low. So because it is blood deficiency, not the excessive, a lot of bleeding. And Dangi Bushuetang, remember this ratio. Only two ingredients, Dangi and Huangqi. Actually, it tonifies qi and blood. But I don't know why they categorize this tonifying blood formula. Maybe just because of its name. Because its name says tonifying blood. But actually, tonify blood and qi. So what is the keyword for this formula? Exertion. Over-exertion is the keyword. So after moving the company, the patient troubled with a lot of nighttime work, and he is totally exhausted and have a symptoms like blah blah blah, like common cold-like symptom. There is 당귀 부쉐탕, overexertion. Okay, remember this as a keyword. General weakness after overwork. 바젠탕, not much of explanation for 바젠탕, but remember this. Sichuan dabutang, what is the difference? Huangqi and Rugui tonifies yang. So 바젠탕, qi and blood, but Sichuan dabutang, yin and yang. So it tonifies yang deficiency. That is the big difference between Sichuan dabutang and 바젠탕. So underline the part, tonifies yang. So cold manifestation. And 구이피탕 treat both symptoms, shen and blood, bleeding. Shen and bleeding. So there is 구이피탕. So bleeding, lost control of blood circulation by spleen deficiency. This is one pathology. And stress and mental exhaustion with spleen deficiency. 구이피탕 for depression. So when the question asks you about 구이피탕, the question will give you both signs. There's the depression like a mental signs and blood and qi deficiency, both signs. Then 구이피탕. How about wendan탕? That will give you heat signs. Same insomnia, depression, heat and phlegm signs. That is wendan탕. But 구이피탕 only deficiency signs, totally different. And compared to 부정이치탕, 구이피탕 is bleeding and insomnia. 부정이치탕, low fever, qi deficiency fever, and organ prolapse. Those are the keyword. And compared to 샤오야오산, 구이피탕 do not have wiry pulse and stress, the liver qi stagnation signs, and 구이피탕. That is the difference. So we did all this already when I talk about 유외디왕wan. So 조기wan and 요기wan. So which herbs removed from 유외디왕wan? Remember this herbs, sedating, 3 sedating herbs. Fuling, 제시, and 무담피. That is yang tonifier. 진구이 shenchiwan. Just remember which herbs I added. Fuji and rogui. Fuji and rogui to tonify yang. Which herbs added to 바젠탕 to make Sichuan dabutang? Huangqi and rogui. And 바웨이디왕wan, Fuji and rogui. Similar. Same yang deficiency. They treat yang deficiency. And 바이해 구진탕. Sometimes it is classified as yin tonifier and dryness formula. Either way is fine. This one is very similar to my way D11. It treats dry coughing with yin deficiency. And I think you'd better memorize this formula, because even though this is not listed in among 83 formula, Dihuang, Shanshen, and Mai Mendong, this is Zhengne Tang. Zhengne means increase the fluid. That is Zhengne. So Baie Gujintang treat very chronic and weakness of coughing. So what kind of condition? Tuberculosis and long-lasting pneumonia, extreme chronic condition. So nourish in this kind of condition, tuberculosis, streak of blood, not excessive bleeding, but streak of blood. This can be shown as a sign. Night sweating, severe yin deficiency, and steaming bone sensation, severe yin deficiency, and streak of blood. Those are the keyword for Baihe Gujintang. Li Zhongwan, substitute Fuling incision jitang with ganchang. Remember that. So ganchang warms middle jaw. So warming middle jaw, yang deficiency. And tie-in is another keyword, tie-in. This is tie-in formula in Sanghanrun. So yang deficiency, specifically spleen and diarrhea. In tie-in diarrhea. Remember diarrhea too. So there we learned many different formulas for diarrhea with the yang deficiency. Sending by Chusan, Shishenwan, and Li Zhongwan. Li Zhongwan is for spleen deficiency. Shishenwan, kidney deficiency. Xiaojianzhongtang. This is based on Guijitang and Xiaojianzhongtang. Remember this ratio too. I emphasized a lot about this. And Yitang is the king herb. So it is kind of counterintuitive. So remember this. Yitang. And also remember this modification too. Huangqi jianzhongtang and Guiqi jianzhongtang. Huangqi treats spontaneous sweating. And Guqi Jianzhongtang treat blood deficiency and qi deficiency. If the question asks you blood and deficiency extreme, those deficiency, Guqi Jianzhongtang. If the question asks you a lot of sweating and weakness, Huangqi Jianzhongtang. And Da Jianzhongtang. Did I tell you that this is the most commonly used formula in Japan? So here is the reason. So Da Jianzhongtang, this is Japanese pronunciation, Dai Kenchuto. In Jingui Yolo, the golden cabinet, this is for abdominal pain caused by extreme cold. That is Da Jianzhongtang. But currently in Japan, this is used for post-surgical ileus, so intestinal dysfunction. So surgeons ask you, did you pass the gas? That is the important thing. You need to pass the gas. And it helps restore your intestine after surgery. And mechanism is revealed, and many surgeons in Japan routinely use this Da Jianzhongtang. And some hospitals adopted Da Jianzhongtang as a routine practice in their clinical course. So there's a reason Da Jianzhongtang is commonly used, second commonly used in Japan, only in hospital, and it is not used commonly in local clinic. There's Da Jianzhongtang, but not commonly used in local clinic. But it makes sense, doesn't it? Because they have open surgery, so it restores the function of the intestine. And Wuju Tang extreme warm formula with Wuju, Rensen, and Senchang. So it tonifies yang also, and it is also commonly used formula in Japan for migraine. So it treats, what is the keyword? Nausea with the coldness. That is the keyword. Rebellious qi. So nausea, vomiting sensation after eating with the coldness. So Li Zhongwan, worms, and Wuju Tang both worms. Li Zhongwan goes to spleen, so treat the diarrhea. And Wuju Tang goes to liver and stomach, so treat vomiting, so opposite, and headache. They have a similarity but different usage. Not for you, skip. Okay, Shoho Lodan. What is the keyword for this formula? Excess cold. Excess cold is the keyword. So two formulas you should remember as an excess cold. So if the question asks you this way, when you touch, pain is worsened. And that pain is worsened with the coldness and released with the warmth. But when you touch it, patient do not like that. That is excess cold. So Xiaohou cannot be used for deficiency cold. And Da Jianzhongtang can be, but usually used for excess cold. So remember those two formulas for excess cold. Xiaohou and Da Jianzhongtang. And Xiaohou once in a board examination, which formula cannot be used for yang deficiency. Okay, can you tell the difference? So Xiaohou treat joint pain with excess coldness. So it worms with Jiao and Jianwu, so Fuji family. So extremely warm and heating formula this is, and treat blood deficiency and phlegm, so to speak, rheuma, and release wind. So it has everything to treat those joint pain. So a lot of neuropathic symptoms, sciatica symptoms with the excessive, not the deficiency signs. So each formula should not be used for deficiency condition. Shoho. Modification question. Severe pain. Rushang, Moyao. This is the combination for killing pain, right? So this is the right modification. And Xiaofengshan. This is for skin disease with wind damp heat. Remember this. So what are the signs? And question, do not usually ask you with this literal word, but weepy, soggy, itching, red region, or swelling, or inflammation. If all these three signs are there, Xiaofengshan. So it is kind of early stage. So when you take Xiaofengshan, because it treats heat with spicy and hot greasy food. This is common sense, right? When you treat skin disease. And Zhengan Shefeng Tang. Treat liver yang raising. And Zhengan Shefeng Tang and tiamakotingin. Just remember that those ones as a liver yang raising formula. But remember this, tiamakotingin is a more sedating formula, and Jengan Shefeng Tang is a more tonifying formula. Tiamakotingin more heat, clearing heat. If the question asks you with a rapid pulse and extreme heat signs, pick tiamakotingin, and indeficiency signs and Jengan Shefeng Tang. But both of them actually treat liver yang raising, and liver yang raising is based on indeficiency pathology. Very similar formula. So this is only for the examination. What I tell you now today is only for examination. Many of them does not consist with actual practice. And Sanjiao Rentang, what is the keyword? Insomnia. It treats insomnia, Sanjiao Rentang. And also, what you need to remember is this wiry pulse too, because it goes to liver, heart and liver. So remember, it goes to liver. So wiry pulse can be given as a hint for Sanjiao Rentang. And Huangyan Erjiao Tang, excess on a chest, but Suji Jiangji Tang. Do you remember that cough medicine? Suji Jiangji Tang, excess phlegm on a chest, but this is excess heat on a chest. And weakness, indeficiency in the kidney, kidney indeficiency and heart heat. There's Huangyan Erjiao Tang. Chest, heat in the chest, phlegm in the chest, Suji Jiangji Tang. But heat in the chest, Huangyan Erjiao Tang. This is for irritability, anxiety, mental symptoms. And Gammai Da Zhao Tang, what is the keyword? Melancholia, mood swing, Zhang Zhao. That is the keyword. Sudden urge to cry. So I have seen many different type of question book about Gammai Da Zhao Tang. So if you see those sudden cry, sudden laugh, melancholia, mood swing, then you should be able to pick Gammai Da Zhao Tang. If you have my book, try to check all those frequently used formula for mental problems. This is Shishan one. This is for kidney deficiency. So what is the keyword? Day-breaking diarrhea, cock crow diarrhea. It can be described in many different ways. And Gujing one. There are some formulas with stabilizing mens and the essence, sperm. And this is for sperm, securing essence, emission. And this is for deficiency. And once Gujing one treat those symptoms, you should change the into the formulas treat root, because this is for branch. Only subside the symptoms by securing it, stabilizing it, and it does not tonify kidney. So if you want to tonify kidney, you should better use Shenchi one or Liuwei Diong one and combine them with Guqing one. So Guqing one, essence, seminal emission. And this Gujing one, same name, Gujing one, this is for mens. Same name, Gujing one. And Jinshui Gujing one is for seminal emission. This is for menstrual bleeding, bang, low. But this one has a very cooling property, not like Wenjing Tang. Wenjing Tang, warm property. But this Gujing one has a cooling property. So this treat heat sign, sensation of heat and thirst. So uterine bleeding with the heat sign. And how do you modify when there is a excess bleeding? Diyu or Huihao or Xianhachao. There is all stop bleeding herbs. So combine these herbs for stop bleeding, for excessive bleeding. And Wen Dai Tang is for qi deficiency. What? Vaginal discharge. White vaginal discharge. Longdan Shegan Tang was for heat signs, heat vaginal discharge. This one, white, because of qi deficiency. So two Gujing one. One Gujing one treats seminal emission, and second Gujing one treat bang low with the heat signs. And third, Wan Dai Tang treat discharge. Remember those three formulas. And treat abscess formulas. Luckily, California do not require to study these formulas. 83 formulas categories. Those categories can be